Hello everyone, hope you're doing well. First of all, I would like to thank you that you have been continuously following us, watching my videos related to dentistry and other stuff. Here is another new edition. Today, the topic I'm going to discuss is irrigants used in endodontics, a very important step when we are going to do root canal treatment in the tooth. These irrigants basically are very main helpful tool during our root canal procedures, and their proper use and selection is very important for both the dentist to perform the root canal treatment as well as for the patient in order to to completely eradicate or finish the infection in the tooth. So, irrigants used in endodontics. The first irrigant we commonly use is sodium hypochlorite. Let's discuss its concentration. It's normally 0.5 to 6% is the concentration which is commonly used for root canal purposes. And the key benefits which we get from sodium hypochlorite are: it is a strong antibacterial as well as tissue dissolving reagent. It dissolves the necrotic tissue, necrotic pulp very quickly and very effectively. Second, it's effective against biofilms and organic pulp remnants, whatever necrotic stuff or decayed pulp that remains in the tooth canal, that is very much destroyed and easy to remove with the help of use of sodium hypochlorite. But along with its benefits, it has some limitations, like it is toxic if it extrudes beyond the root apex. If it is means too much used, that it can go beyond the apical foramina and into the underlying tissue, periodontal tissue, and it may cause inflammation. And then it has some unpleasant taste, and it can even weaken the dentine at high concentration. So we have to very much careful about when we are using sodium hypochlorite. We should inject it very gently and in a very small quantity. Whatever we need, we should not inject it very forcefully so that it doesn't cross the apical foramina and cause inflammation. But otherwise, it has multiple good advantages. The second root canal irrigant used is ethylene diamine tetraacetic acid, EDTA, very common name. Every dentist usually understands it. And its concentration, which is used for dentistry, is normally 15 to 17%. And the key benefits which we can get from EDTA is it chelates the calcium, removing the smear layer and opening the dentinal tubules. It's very helpful, especially for narrow canals, teeth, and obliterated root canals. So when we use EDTA, it opens those tubules easily so that we can easily remove the debris, necrotic pulp, infectious pulp from the canals. It is often used as a final rinse after sodium hypochlorite, means first sodium hypochlorite is used and then EDTA is also used as a second addition for getting a good canal without any further bacterias or dead tissues. It also has some limitations like no bacterial effect alone, usually combined with sodium hypochlorite. So it is always, most of the cases, it is recommended that first sodium hypochlorite and then EDTA both should be used in a combination to get better results from the canal. The next one irrigant use is chlorhexidine. It's just like a normal mouthwash, chlorhexidine mouthwash, which we normally use. It has about 2% concentration, is preferred for use if we don't have sodium hypochlorite or don't have EDTA, and we have available chlorhexidine at the clinic at house, so we can just use that chlorhexidine to clean the canal. It has broad spectrum antimicrobial benefits with prolonged effects, and it is effective against enterococci facilis, which are common post-treatment infection after even doing root canal. Secondary infections the bacteria can cause, so it is effective against those. Again, its limitation includes it does not dissolve any tissue like sodium hypochlorite. It can form a brown precipitate if it is mixed with sodium hypochlorite. Next one we can use is hydrogen peroxide in about 3% concentration, which is normally used. No, we should abstain from using higher concentration, and to get the maximum benefits, like it has a foaming action which helps mechanical debridement, means bubbles are formed in the canal, which even are very much helpful when we do filing to remove the dead tissues, debris. And similarly, like other irrigants, it has some limitations, like it is weak antibacterial effect. It is rarely used alone today. So along with sodium hypochlorite, hydrogen peroxide can be added as well to get more beneficial effects. The next we can use is MDTA, that is mixture of tetracycline acid and detergent, MTAD. Its composition is it contains doxycycline, which is an antibiotic, then citric acid and tween AT. This composition is basically very helpful to remove the smear layer, and as well as they have antibacterial properties due to its presence of doxycycline. And limitations are it is a bit expensive compared to sodium hypochlorite, chlorhexidine, EDTA, and it is less commonly used than EDTA. So it has good combination, good benefits, but due to expensive, it is about limited. But it's not very much expensive that most of the dentists they prefer to use MTAD to get a better result. The next one used is Qmix. It has chlorhexidine plus EDTA plus detergent. It's a combination of two, three things, and its benefits is it combines the smear layer removal and antimicrobial effects. Then we have iodine, potassium iodide, IKI, which is very much effective against fungi, Candida albicans, as well as some bacteria. So to prevent the secondary infections in the canal, but it again has some limitation that it can stain teeth temporarily because of iodine, which is a colored product. So it can stain teeth, but that staining is mostly a temporary, which can after a couple of days that disappears, but it does have good use, good benefits against fungi as well as bacteria in the canal. Then in the latest technology, we can use laser activated irrigations and photo activated disinfection, PAD, photo activated disinfection techniques, or laser. It is just like small laser machine in which we release the lasers radiations into the canal, with they can completely eradicate, kill the microorganisms as well as dead pulps, which is later on with the help of EDTA and sodium hypochlorite can easily be removed. This is basically an emerging techniques which is in the process of more use, more experiments, but it does give good results. It enhances the irrigant effectiveness using laser or special dyes which we inject inside the coronal pulp, crown pulp, or into the canals. Now, at the end, we will conclude the best practices in the endodontic irrigants. First, we normally use alternate sodium hypochlorite and EDTA for getting optimal cleaning, getting maximum results. These are the number one, which majority of the dentists they prefer and they get good results. Then use of ultrasonic activation to improve the irrigant penetration means that we inject small quantity of sodium hypochlorite EDTA and then we can use endomotors just to slightly irrigate the deeper canals and then we go for final rains with chlorhexidine or Q-mix for getting prolonged antimicrobial effects and avoid mixing sodium hypochlorite and chlorhexidine because they can cause precipitate. So sodium hypochlorite plus EDTA or chlorhexidine and Q-mix they should can be mixed. So they are mostly alternatively these products are used to get better results and to make our canals very much sterile and getting maximum benefits without bacterial canals so that our root canal procedure can be successful. So at the end, I would like to say good luck for the dentists who are doing root canals, especially new graduates. They should follow these things, follow these rules. They will, I'm sure, they will help to get maximum benefits from the canals to make the canals bacteria free and get maximum good prognosis of the root canal treatment. So at the end, I would like to say if you have any comment, please give me some suggestions or questions. If you have any queries, you can always write in the comment section and we'll be back. And again, once again, don't forget to subscribe for our upcoming next videos, which will hopefully they would be very again helpful for your dental practices. Do subscribe our channel. Thank you very much.